And you are doing research in the genetic aspect of mood disorders and anxiety. And please give us the medical definition of genetics. What are you referring to when you talk about genetics?
Sure. We know that many of the illnesses that psychiatrists treat, and many illnesses in general, tend to run in families. And there are lots of reasons why an illness may run in families. Perhaps that there are some shared aspects of the family environment, certain habits, certain common exposures. But one of the most important reasons that illnesses run in families is genetics. Genes are the things that we inherit from our parents that actually are the blueprint for our underlying biology. They encode the proteins and the other molecules that regulate our metabolism, our growth, and our development. Now, we've known for probably over 50 years that some of the conditions I've mentioned already, such as bipolar disorder, depression, schizophrenia, and some of the anxiety disorders have a genetic component. That doesn't mean that they're entirely determined by genes, but just that there's a tendency for these illnesses to run in families, and that tendency is explained, at least in part, by the genes. Now, the reason we want to understand the genes that are involved is they can give us clues to the underlying biological processes, the underlying changes in the brain chemistry that actually cause these disorders in the first place. We don't know enough about that at this point, and most of the medications and treatments that we use nowadays are not based on any deep understanding of what brings about these illnesses in the first place. So we're hoping that if we can identify the genes, that we'll begin to piece together a story of the underlying causes that will allow us to develop better treatments, come up with better ways to diagnose the conditions, and ultimately, maybe, to learn how to prevent them.